Welcome back, my dear students. Today we are going to understand diarrhea, a condition that may seem simple but can actually be life-threatening if not managed properly. Diarrhea happens when the normal balance of fluid absorption and secretion in our intestine is disturbed. This could be due to infection, toxin, food intolerances, or even chronic diseases. The result, the frequent watery stools that cause dehydration, weakness and electrolyte imbalance. In this class, we will explore the risk factors, the pathophysiology behind different types of diarrhea and the most effective management strategies including ORS, antibiotics and preventive measures. Let's dive in and make the science of diarrhea simple, clear and easy to remember. Diarrhea. Introduction. Diarrhea is one of the most common health problems worldwide, yet it is more than just passing loose stools. It reflects a disturbance in the finely tuned balance of absorption and secretion in our intestines. Let's break it down step by step in a simple and interesting way. How does diarrhea happen? Stepwise mechanism. Diarrhea may be caused by bacteria or parasites found in food and water. Entry of the cause or trigger: infection, bacteria, viruses or protozoa, toxins, cholera toxin, food poisoning, food intolerance like lactose, gluten, drugs like antibiotics or laxatives, chronic diseases like IBD, IBS, hyperthyroidism can trigger or cause diarrhea. Disturbance in intestinal function: more secretion of electrolytes and water into the gut causes watery stools, that is secretory diarrhea, such as example cholera. Less absorption of nutrients and water, osmotic diarrhea, example lactose intolerance. Mucosal damage, leakage of blood, mucus, proteins caused by Shigella, entamoeba, etc. Increased motility, food rushes through the gut before absorption through IBS or hyperthyroidism. Excess fluid in the gut. Colon fails to reabsorb the extra water load. Result: clinical features: frequent watery stools, loss of electrolytes Na plus, K plus, Cl minus and HCO3 minus. So it causes dehydration, acidosis and weakness. Risk factors: who is at higher risk? Infections: bacteria like E. coli, Vibrio cholerae, Salmonella, Shigella, these viruses or rotavirus or noroviruses. Protozoa like entamoeba histolytica or giardia lamblia. Unsafe food and water, poor hygiene sanitation, poor handling habits, children with malnutrition and weak immunity, antibiotic use which disrupts normal gut flora, food intolerance or allergies like lactose or gluten, chronic conditions, IBD, IBS, endocrine disorders, etc. Pathophysiology: basically there are main four types of diarrhea. Secretory diarrhea, which is caused by toxins such as cholera toxin or E. coli. Mechanism: chloride and water secreted excessively, water stools. Osmotic diarrhea cause unabsorbed solutes. Lactose intolerance. Mechanism: water moves into the gut, diarrhea stops if fasting. Inflammatory diarrhea cause mucosal invasion, Shigella or entamoeba. Features: blood, mucus, pus in stool, etc. Motility related diarrhea cause rapid gut movement, IBS, hyperthyroidism, etc. Effect: less time for absorption. Common outcome: excess fluid in intestine which is frequent, watery stools, dehydration, electrolyte imbalance and metabolic acidosis. So diarrhea causes loose or watery stools more than 3 times per day. It can be acute, persistent or chronic. Diarrhea can be inflammatory, watery or fatty. Management: how do we treat diarrhea? General management: rehydration therapy, oral rehydration solution or ORS, life saving and simple. IV fluids if severe dehydration. Nutrition support: keep feeding especially for children, avoid fasting. Zinc supplements in children reduces severity and duration. Probiotics may help restore normal gut flora. Specific management: so with antibiotics only if bacterial or protozoal cause is confirmed. Shigella, we should treat with ciprofloxacin. If cholera occurs, doxycycline and azithromycin. amoebiasis or giardiasis, we should treat with metronidazole. Anti-mobility drugs such as loperamide use cautiously, never in children or in case of bloody diarrhea. This is the images of 10 best natural remedies for diarrhea. Prevention. Best way to fight diarrhea: safe drinking water and good sanitation, hand washing before meals and after toilet, rotavirus vaccination in infants, avoid unsafe street food. In a nutshell, we can say diarrhea is not just about loose motions. It is the result of an imbalance between absorption and secretion in the intestine, whether caused by infections, toxins, intolerance, or rapid motility. The main danger lies in dehydration or electrolyte imbalance. So I hope this class helped you to understand diarrhea, why it happens, the risk factors that make us more vulnerable, and the different mechanisms like secretory, osmotic, inflammatory, and motility related diarrhea. We also discussed how fluid loss leads to dehydration and electrolyte imbalance, and why ORS, zinc, proper nutrition, and timely treatment are so important in management. Remember, prevention through clean water, good hygiene, and vaccination is the most powerful way to fight against diarrhea. Stay safe, stay healthy, and spread awareness in your community. If you found this lesson helpful, don't forget to like, share, and subscribe. See you in the next class. Thank you.